So the project that we are presenting here at ASH is looking at a large commercially insured database of patients that have von Willebrand disease. And so the difference in this study is their criteria for von Willebrand disease would be what if the provider used that ICD-9 code. Okay, so the study was actually looking at patients from 2006 to 2015. Basically what we were looking at was the differences in bleeding and treatment before and after diagnosis of von Willebrand disease, specifically in this study looking at patients from 2 to 11 years old as the children cohort and 12 to 17 in adolescents. And so we initially looked at patients 18 months before their diagnosis of their claim codes, looked at then the time when they were diagnosed with von Willebrand disease, and gave a 6-month time frame before we analyzed some of the codes to give time for treatment optimization and such, and then looked at a time period beyond that. And what was interesting is we found that one thing was the types of individuals that were diagnosing the von Willebrand disease. You would hope as a hematologist that it would be a lot of hematologists diagnosing, but actually more primary care physicians, hospitalists, OBGYNs, ENTs were making diagnosis, and then presumably based on the codes may have been treating the von Willebrand disease as well. However, one caveat to the study is not knowing some of those patients that were labeled as hospitalists may have been hematologists, and it was just part of the data capture process. But we looked at the types of bleeds that they would have, and we found somewhat of a decrease in bleeding events from pre to post diagnosis. And then we also looked at the types of treatments they had that I had previously mentioned, such as DDAVP, concentrate, antifibrinolytics, etc., nasal cautery procedures, things like that. Yeah, so the outcome of the study was that we noticed that there were some fewer bleed claims after patients were diagnosed, and that there was some increase in treatment as you would expect. But what was interesting was to see how some patients continued to bleed, and suggesting that some of these patients are being suboptimally managed as well. So kind of leading us more to the need for raising awareness for von Willebrand disease amongst our colleagues and amongst primary care physicians, so that we can, first of all, get patients diagnosed appropriately, and then secondly, to be able to manage them appropriately for the types of bleeding that they're having. The most kind of severe ongoing bleeding patients had in our study was joint bleeding or gastrointestinal bleeding, as I mentioned previously. It's pretty common for that to be the more severe bleeding in von Willebrand disease.